As you watch this video of a resident-patient interaction, reflect on the feedback that you would provide to this resident if you were supervising her. Then, watch the supervisor provide feedback. What does she do well? What would you do differently?
So my back, it really is starting to hurt.
So is it when you start to exercise that it gets worse?
Well, yes, exercise definitely does make it worse.
What kind of exercise makes it worse?
So I find walking is one thing that just makes it start.
Maybe we could start at the beginning. So maybe we could talk about what really makes the physical activity for your back pain sort of worse.
Well, you know, it's when I'm doing walking or exercise.
So you're finding that any kind of physical activity makes it worse?
Well, like as I said, walking, yeah, sort of anything is making it really bad.
So how do you think that patient interaction went?
I think it went really well. I was able to get a good differential diagnosis and I think a good management plan.
Okay, well, you were certainly able to get the information you needed, but in observing you, there's definitely a few things that I noticed that you could maybe improve on. So when you're asking your patient questions, I noticed that you often don't give them time to complete their answer and that you were cutting them off quite a bit. It's really important when we're talking with our patients to allow them to get across exactly what they're feeling and allow them to complete their train of thought. Anything else you think you could have changed in the interaction?
No, I think it went really well.
Okay, well, another thing I noticed was the way in which you're asking your questions. It's really important for us as physicians to show interest in our patient, and it came off sometimes when you're talking to your patient that you weren't that interested in what they had to say for their answer. Is everything okay with you? Anything that's been interfering with your clinical abilities?